Andy Austin here, up in somebody else's attic to talk about hypno-analgesia. Every once in a while, the news story breaks into the tabloid press in this country, and probably in other countries too, where, miracle of miracles, somebody has had surgery using hypnosis. Obviously not the hypnosis to do the surgery, hypnosis to do the anesthesia. And it was incredible because they felt no pain. And here's the video footage, or the photograph, here's the interview with a member of staff saying how incredible this is. It's never happened before. It's groundbreaking. Yeah, that does the rounds a lot. It's been a while since I last saw that story. We're probably well overdue another version of it. And what this seems to create is this understanding in the public, or this notion in people, including hypnotherapists, about the power of hypnosis. And people hold up these stories as proof for how essentially every claim that's ever made for hypnosis or language-based therapy is validated by this action. There's a whole bunch of stuff, though, that the public and hypnotherapists simply don't understand about analgesia and anesthesia and hypnosis within the role of surgery. Now, you've got various people throughout history who have actually done this as a career, and essentially there's the classic guy, I forget the guy's name now, Braid, was it? Who did lots of surgery. He was a surgeon and a hypnotist on unwilling or willing, I don't know, it's controversial, subjects over in India. Lots and lots of surgery was done using no anesthesia whatsoever. Well, generally back in those days, most people didn't have any anesthesia either. The difference was you've got a power difference between a local and the great white doctor who's coming from overseas with all this power invested in him through the military and various other places. And people do as they're told, and people in different cultures have different levels of compliance. And the controversy is, were these people actually in any way anaesthetized, or were they just basically doing as they were told? And it's likely to be the latter. Although, if you disagree with that, have data or evidence to that, stick it in the comment section. And as always, any views on this subject, do please stick it in the comment section, because it's useful to me to measure where other people are at, and also just other people know things that I don't know. Now, one of the things about surgery is that surgery often isn't quite as painful as people think it is. Largely, the nerve endings are in the surface of the skin, and that when you dig down deeper, there's not a great deal of sensitivity going on. There is, but not quite to the level that people might expect there to be. And even when people have surgery without anesthesia, local anesthetic is used. Whether it's an epidural, or whether it's local infiltration into the affected area, or something called a nerve block. A nerve block would be, for example, where they're doing something on the hand and the nerve leading up to that area, or that particular nerve on the finger, is injected locally with a very small dose of local anesthetic, and it numbs everything downstream from that point that's fed by that particular nerve. And so local anesthesia is used. Now, why do doctors like general anesthesia? What's that all about? Why do we need to have general anesthesia? Well, for a lot of the time, the surgery can take hours. And so essentially you guarantee patient compliance by having them unconscious. And that's quite a useful thing, because the last thing you want is a patient fidgeting and getting uncomfortable, getting bored, getting frustrated, having emotional reactions, having a panic attack, all the things that can happen. And you don't want that when they've got their guts sort of lifted out onto the table and surgery is being done. So generally, we like people to be still and non-responsive when doing major surgery on people. Often, local anesthesia is still given as well as the general anesthesia as well. So when the patient then wakes up, they still have the effects of the local anesthesia. Therefore, they're relatively pain-free. And that's a very common thing too. There's plenty of surgery that's done awake. I have seen a number of people have things like hip replacements. They're perfectly awake. They will use a nerve block or a spinal epidural, to numb from the waist down, and they can then do some pretty hefty hammering and sawing to do a knee replacement or hip replacement. And that's not entirely uncommon. There are plenty of forms of brain surgery that are done with the patient completely awake. Now, what would make that now a hypnotic process? Simply labeling. And this is my argument for this video. I would put to you that when I have seen patients completely awake having surgery done under local anesthetic or under spinal epidural, the staff talk to them in a way to maintain a particular mindset and a particular calm. The staff themselves are very, very skilled in this kind of stuff. They have to maintain a certain atmosphere in the environment in which the surgery is taking place. And of course, you have the anaesthetist and often a senior nurse at the head end of the patient talking to the patient throughout. And the patient has screens up, so they basically don't get to see what's going on the other side of that. They'll talk in dulcet tones, they'll be soothing, they'll use all the right words, they know not to say stupid stuff, and those kind of things. Is that hypnosis, or is that just people talking? Now introduce somebody into that environment who has done a hypnotherapy course. They're pretty much going to say the same sort of stuff in pretty much the same way, but now it's hypnosis, as opposed to professionals talking to a patient in a calm manner, keeping them calm. And so what I believe is that most of what passes for hypno-analgesia, hypno-anaesthesia, is nothing of the sort whatsoever. It's just simply somebody in that environment has done a training course and they are now labeling the communication in a particular way that otherwise would be happening to a larger degree anyway. And that there isn't really... Hypno-analgesia and hypno-anaesthesia is not as common as people make out. Even dental surgery is largely performed with local anaesthetic. And a dentist who is very calm in their manner, very confident in their delivery, can put a patient at ease, but isn't a hypnotist. They're just a dentist who is able to do things with people in a particular way. Send them off on a dental hypnosis course. Now they're hypnotizing the patient. Well, they're probably doing exactly the same thing. So there's a whole bunch of different things that are happening simultaneously, but the issue of, is hypnosis the miracle that people want it to be in order to validate all the other claims that people like to make? No, it's not. As always, feel free to agree or disagree, cite any studies, any links. I'm always interested in that. YouTube, unfortunately, are automatically deleting about half the comments that people make to the channel. I don't know why. I don't have control over that. So if your comment doesn't appear, I apologize, but it's not me that's doing that. So do have a go anyway. Generally, it's when people post a link, they tend to be removed the fastest because they assume it's spam. So you may just want to remove the HTTP and the 3 Ws and just put the body of the link so people can copy and paste it, including myself, if we want to have a look at that. So thank you for watching the video, and I will see you tomorrow for the next one.